Hello and welcome. I'm JP Miller of the Empire Report, and we are thrilled to host this forum on prescription drug pricing and importation, an issue important to New Yorkers of all ages and especially to New Yorkers 50 and over. Our panel today is being moderated by Rex Smith, former editor of the Albany Times-Union, and now can be found at the upstateamerican.com Substack. Our panel today is made up of both legislative and advocacy experts. Assemblymember Joanne Simon, Zaina Smith, Advocacy Director at AARP Florida, John Bartholomew, Government Affairs Director at AARP, and Bill Ferris, New York State Legislative Representative for AARP. I want to especially thank AARP New York for sponsoring this forum. And here to open our discussion is David McNally. David, take it away.
Thanks to Empire Report for hosting this discussion on the high cost of prescription drugs and what we can do about it. ARP is happy to sponsor this important conversation about making prescription drugs more affordable and more accessible for New Yorkers by creating a way for New York State to import incredibly less expensive prescription drugs from countries like Canada. New York's population is aging rapidly, and many older New Yorkers struggle to pay for their medications. Unfortunately, stories of people cutting pills, skipping doses, or having to choose between filling a prescription and paying their food or energy bills are far too common in New York. There is no one silver bullet to make prescription drugs more affordable, but ARP has successfully advocated for major steps here in New York and nationally, such as creating a Department of Financial Services prescription drug price board where people can report what they believe to be outrageous increases in prescription drugs. That's going on right here in New York State. And nationally, of course, our long-fought battle was won to allow Medicare to start negotiating drug prices at the national level. We're proud of those achievements, but there's much, much more that we can do, including the importation of less expensive drugs from Canada. I'm really looking forward to this conversation, so let's get into it. I'd like to introduce and thank our moderator, former Albany Times-Union editor, Rex Smith. Hello, Rex.
Hello, David. Thank you very much for the introduction and for all of the work that AARP is doing on this really important topic. You know, this should be an informative discussion about the new developments that are occurring across the country on prescription drug policy, including interaction with other countries, especially our neighbors to the north in Canada. So we certainly look forward to that. We all know that our population here in New York is aging rapidly. Many older New Yorkers are struggling to pay for their medications. And the fact is that older people in our country, that is, people 65 and older, regularly rely on at least one prescription drug. More than 40% take 5 or more. And there has been, of course, as David referred to, some action on the federal level, and we'll hear more about that. The unprecedented policy, though, that occurred about 5 months ago in Florida is something that is important. We have an expert to talk about that. And of course, what's going on in New York with the proposed legislation involving the importation. We're very lucky to have that expertise here as well. So let me just reintroduce the panel, as JP mentioned. First, we, of course, are happy to welcome Assemblymember Joanne Simon, who is the sponsor of the legislation that we're especially interested in here. That is A7954. Remember that number, folks, because that's going to be an important one for you. We are also happy to have with us Zane Smith from AARP Florida. She's the director of advocacy there. John Bartholomew is a government affairs director for AARP. He's based out in Portland, Oregon. And Bill Ferris, who many of you will know, who is AARP's New York State legislative representative. It's a terrific panel. We're going to take only about a half hour of the time of our viewers because we know everybody is busy and has a lot to get back to. But let me start actually with John Bartholomew, who might be able to give us an overview, because we hear a lot of talk, John, about importing drugs from Canada. But the question that I think a lot of us wonder is, how can a state do that? And how does it, who actually has to approve a state doing that? What's the overview there?
Right. Well, thank you very much for having me. I used to live there in Albany myself. So under the Food and Drug and Cosmetic Act, the U.S. Secretary of Health and Human Services has the authority to allow for importation of certain drugs if safety and consumer savings can be assured. So this would be a state-administered wholesale drug importation as opposed to a system where individuals can import their own drugs. So, and it can be structured in multiple ways. It could either be available to all state residents or just enrollees in the state payer programs such as Medicaid or state employees. It could be all state licensed payers. It could be distributors, dispensers. It could be a lot of drugs or just a handful of drugs. But ultimately, this needs to be signed off on by the Department of Health and Human Services at the federal level.
And the federal level has to approve every state individually doing it?
Yes, they do. Yes, they do.
Okay. So that requires some work at the federal level as well. So let's talk about why prescription drugs are so expensive in the U.S. compared to Canada and other foreign countries. John, what do you think it is that makes that the case in America?
Yeah, I think that part of it is, first of all, the drug manufacturers they're trying to make a profit, and they're going to make as much profit as they possibly can. And from looking at it at an economics level, there's an inelastic demand for a lot of drugs. It's like, if you need a drug to live, you need a drug to live. So you have to buy it. So they can set the price wherever the market will bear. Now, in other countries, such as Canada, they're able to negotiate for much lower prices because there's fewer purchasers ultimately, in these other countries, and they have laws set in place that allow them to set what they're willing to pay for any particular drug. And this has led to, the drug prices in the United States are on average about 42% higher in the US than they are in Canada. And just a couple examples of drugs that we've probably all heard of. Cosentyx. They have a lot of ads on TV. It's for arthritis. And this is even a couple of years ago, but in Canada, it costs about $1,350 per month. But in the United States, it's over $5,000 per month. So it's almost four times as much in Canada for the same exact drug. We're not talking about a different formulation. We're not talking about, it's a completely different drug. No, it's the same drug. And they, Canada says, well, we're only willing to pay X. And so, but in the United States, you have every individual drug or insurance plan trying to negotiate for a price, but we just don't have the leverage in the United States that they have in many of these other countries.
Though we have gotten, as you pointed out, now the beginning of Medicaid negotiating on this. Does that create the capacity for this to be more broadly applied across the board?
I believe that it could be in certain ways. I mean, as we go forward with Medicare negotiation, we're going to see other states looking at saying, well, we're going to set an upper payment limit based on what Medicare negotiated for the same drug. But states are also paying for a lot of different drugs that Medicare isn't necessarily interested in. Medicare largely is going to focus their negotiation process on a small handful of drugs that are, needed for that particular population. But so that's still not a silver bullet either.
Right. Okay, well, let's talk about some of the practical experience where there's actually been some success, because earlier this year, Florida became the first state that was approved, as you said, to establish an FDA-regulated drug import system. So the question for Zane Smith, who is the expert on this topic in Florida, the AARP legislative director there, what happened in Florida? And what do you think is going to be going on in Florida moving forward?
Sure, thanks. Great question. I'll start off by saying this was a long path. We passed our importation bill back in 2019. It was a hard-fought battle. There was bipartisan support, but there was also bipartisan opposition. We worked hand in hand with our new, at that time, Governor Ron DeSantis to usher this into a reality for Florida consumers. Like I said, it started in 2019. Here we are in 2024 with final approval. So that time period in between, there was a lot of hard work with our Agency for Healthcare Administration, along with the other state agencies that are a part of the importation plan, to really develop our plan and set forth the eligibility requirements that the FDA and the Health and Human Services at the federal level mandated that we explain. So what kind of cost to consumers would be realized if approved? What drugs are actually going to be on the list? Because our legislation prevented certain drugs like biologics, opioids, benzoids, any type of restricted drugs on higher level schedules determined by the DEA. So most common drugs, what type of savings, and what kind of steps is Florida going to take to ensure that these are safe and reliable prescription drugs that are now being passed out and provided to consumers. So that took at least 2 years. So that gets us to 2020, when we were able to work with HHS, have our draft plan in place. We got tentative approval on our draft plan. We get to 2021, where we got additional approval through HHS, and it then shifted to the FDA. And now you see the realization that we finally have FDA approval. So we're far from actually seeing drugs get imported right now. So I want to make sure that expectations are managed in terms of what this really looks like after a piece of legislation passes. But we have 2 years upon the first importation of a drug to prove that what we set forth in our plan is working and that savings are realized. According to our state officials and to the governor's office, Florida is set to save over $180 million in year one when this is fully implemented. And that's savings to taxpayers and to the state agency budgets. So we're hopeful that this will become a reality in 2025. I know that's the timeline that's been given by our Agency for Healthcare Administration and the governor's office. So we look forward to seeing this play out in real time in 2025.
Yeah, that is quite a long road toward actually accomplishing what you set out to do, it sounds like. And I might just ask you to follow up on one point. Florida, of course, is a state with a lot of older Americans. Look at me, half my friends have moved there. But I imagine that there is the value of the political advocacy on the part of ordinary citizens that probably led to this being possible, because older Americans are such a potent force in Florida. Can you talk a little bit about the value of citizen engagement on this topic?
Absolutely. I'll be very candid. We took on Big Pharma here in Florida, and I think at the time they dumped over $8 million into ads lashing out against AARP, lashing out against the governor's office, legislative leaders, trying to make claims that these drugs would be unsafe and that people would be dying from fentanyl overdosing, even though we're not even talking about fentanyl or any of the class of pharmaceuticals that would contain fentanyl being imported. So the true power was the voice of the everyday person, really saying, we're tired of the big pharma's greed. We're tired of having to pay these exorbitant prices. We have many people in Florida that are what we call seasonal residents. They come from Canada and live in Florida for up to 6 months at a time. And they had a lot of very powerful testimony explaining that when they're in Canada, the same drug that they have to get here in America is far less expensive. So really, it was impactful to hear from people that are living, paycheck to paycheck or Social Security check by Social Security check, and really on fixed incomes, that when you see any type of increase on your necessary medications, or you're just having to pay high prices regardless, it really is a financial strain, and it goes to the health and well-being of aging into our golden years. So yeah, people making those calls to their elected officials, calling and talking to their friends to get support and really generate a grassroots groundswell of individuals who said enough's enough, let's beat back pharma's greed, and it was effective because we clearly won the day here in Florida.
Terrific. I can't imagine that it's a good political tactic to attack AARP. It's about the most trusted organization in the country. You won. Let's look at New York State. Assemblymember Simon, you are the expert on this at this point, because you actually have introduced some legislation to this. And what would your New York bill do with this issue of pharmaceutical importation?
Well, first, I want to thank you for inviting me to speak about this bill. It's very popular. We have a lot of support for it. We have 39 co-sponsors, which is great. I know it will be passing in the Senate if it hasn't already. There's a lot of pressure on here in the Assembly. So what it would do is basically it would create a state program to import prescription drugs from other countries. The primary country we think we would get most of that product from would be Canada. And that's because the bill would require that we wouldn't be able to import things that weren't already approved by the FDA, for example. And they would have to meet rigorous standards. We would be testing on a sample basis to make sure that for purity and potency. They would have to be labeled for the US market. And they would be distributed through retail pharmacies and other settings in the program. So it differs from Florida in some other ways. And so people would, the retail pharmacies and commercial market could order and pay for those products, but we would set up a state wholesale entity that would be the people in charge of distributing that to those retail settings, for example, where people could go to their drugstore. And of course, that would be something set up by the department. to do that. So, even if it passes tomorrow and is signed tomorrow, the agency has a good deal of work to do to set up the program, make sure that they have the necessary boxes checked and that they have the necessary procedures set up to ensure that the implementation is done in a way that is effective and safe. We would basically set the price at the acquisition price from Canada, which is going to be less than the US price. They would not be able to charge a markup. And so that's a key issue as well. And that's one of the ways we will pass that savings on to people. It would be available for people who are uninsured as well as people who are on insurance during their deductible period. So I think that this holds great promise. And I know that I'm looking forward to getting this going. As long as, the other countries that might be involved can provide drugs that are on par with the U.S. drug supply chain and the significant requirements that we have with regard to the purity of the products, I think we'll be able to get this done in a way that really works for New Yorkers. 25% of New Yorkers can't afford to refill their prescriptions, and that is not a good thing. That is something we are trying to address very directly in this bill.
So wholesome that it makes you kind of wonder who's lobbying against it. Maybe I should ask Bill Bill Ferris that, who is the New York State Legislative Director for AARP. Bill, where do you find the opposition coming?
Well, I'll reference what Zane said. Nothing's different in New York than Florida on this issue. It's our understanding that the pharmaceutical industry and the trade group Pharma are opposed to this bill. And one of the issues they bring up, our understanding, is safety. And I think the Assemblywoman just addressed the issue that under her plan and the plans that's going to be produced by the Department of Health is going to ensure safety, as well as John mentioned, the federal government will ensure safety of the drugs coming across the border, most likely Canada. And one last piece on the safety issue, some of the research that AARP has seen, and actually from the GAO, the Government Accounting Office, that 40% of the drugs sold in New York are actually manufactured in a different country. And 80% of the material used for a drug comes from a different country as well. So the FDA is fully capable of ensuring safe drugs and importation into New York. And obviously the federal government approved the Florida plan. So we do what we do all across the country is we push back. And in fact, 30 organizations across New York just endorsed and supported the Assemblywoman's bill. And I think that's a telltale sign that there is support, there is grassroots support of New Yorkers to help the Assemblywoman push this in her House.
Has this bill been introduced in prior legislative sessions? That is, are we finding success building over years, or is this a first effort?
Well, I will say that this bill was originally introduced by another member who has left the Assembly, and so I have picked up the bill. I can't tell you, I'd have to check. I'm sure I could check online, but I don't know for how many years we've had this bill. But I think it's relatively new. It's just since January that I've got the bill. One of I have not had Pharma reach out to me. I'm sure they're lobbying against it. In some respects, they're probably lobbying against it more heavily with the governor's office, for example, because you pass a bill, unless the governor signs it, it's not going anywhere. So that would be my best guess in terms of where they have spent their efforts at this juncture. There is a little technical issue with the bill that we're trying to resolve. As it turns out, in New York, the program would have to be set up through the Department of Education, which licenses those different fields. Everybody but law is licensed through the Department of Education, and the program would be set up there. So the bill would read pretty much the same, except it would be a different commissioner. So we're trying to get some resolution of that, and with that tweak, it should be ready to go.
And if I can add to this question about momentum on the bill, and is this the first time across the country? Colorado was the first state to enact a law for importation of drugs. Florida followed shortly after, and Florida is the only one so far that has had its plan approved by the federal government. But you have red and blue states both. It's a bipartisan, nonpartisan issue. Maryland, Vermont, Maine, New Hampshire, and Texas have all passed laws to create these plans of importation of drugs from Canada or potentially other countries if they can assure the safety standards as well. So this is something that there's a lot of momentum on across the country because states are looking as hard as they can at what we might be able to do to save money for our consumers and taxpayers because of the high cost of prescription drugs.
Let me ask Bill Ferris also, is this only applying to Canada, or might there be drugs imported from other countries as well?
The bill opens it up to different countries, but I think what the Assemblywoman said earlier, it's all eyes are north on Canada for possible importation. And I know Texas or Florida is also looking to Canada. And so I think that's what, the bill doesn't say Canada, but everyone believes it will be Canada. And another thing that John said about it's a bipartisan issue. The bill did pass the Senate this year, and a lot of Republican senators voted for the bill. And that's another sign that, the high cost of drugs really transcends political parties across the country, with big Republican governors petitioning a Democratic administration in Washington, and then they turn around and say, yes, go ahead, you have the green light. And I'm very happy the Assemblywoman is really pushing this issue. So we're fortunate to have that. Thank you, Assemblywoman.
Well, let me ask Assemblywoman Simon then the pragmatic question. The legislative session is scheduled to wrap up in New York in 2 weeks. Do you think your bill is going to actually get a floor vote? Is there a chance that it might not be considered absent significant pressure?
So I would say that's a $64,000 question. Dating myself a bit, but I think that the key here is this issue of how it's drafted and whether it's in the right department. And so I think that there is strong support for that. I've talked to folks just today, within an hour ago, about how to do that. We have to get the department on board and make sure that this is, we do whatever we need to do to craft it within the right environment from an agency point of view. And then, the Senate has passed it, and so they would just basically pass that amendment. So that should happen. It could happen. It really is going to depend on whether we can connect those dots in time. If it doesn't happen this year, it's clearly one of those bills that I'll be bringing forward in the new year, and I'm quite optimistic about its passage.
Well, let me ask you, what would be most helpful to you? How would you advise people viewing this presentation to have an impact on this? If they listen to this and say, this is a sensible idea, what should they do?
Well, I would say, please reach out to your elected officials. And you should do that. Reach out to your assembly member, wherever it is you live, whose ever district you're in, because this is a nonpartisan issue. This is an issue with regard to keeping New Yorkers safe, whatever side of the aisle they cast their ballot. And so you want to reach out to your assembly member and say, this is really important. This is very practical legislation. This will help me be able to take care of my family. This will help me stay safe and healthy. And be able to afford, the medication that I need. I think just about every assembly member themselves has medication needs. They have families. Many people have, elderly relatives and parents. This is something that speaks to everybody at a very basic level. And I would encourage everybody to reach out to their member, because the more support we have within the House, the better off we are in getting that done in the time frame that we need to get it done, to get it passed before June 7th.
Okay.
Because I know we're going till Friday that week.
All right.
But we're going till Friday.
So Rex, just to add to what the Assemblywoman said, we actually have a 1-800 number for people to call across the state. And I believe it's actually running on the screen now. So the Assemblywoman's right. Her colleagues need to hear from the people that this is important to them. And ARP's, we're doing all we can to give her support as she talks to her colleagues in the Assembly to push this.
All right. 877-352-2984. That would be the toll-free number. Great. Well, thank you all. This has been such an enlightening conversation as we think about something that has an impact on so many families in New York State and across the country, and especially an impact on those of us who recognize that we are those aging Americans after all. So we're very grateful to AARP for bringing this forward, and to Empire Report for sponsoring this. So we'll go back to JP.
Wow, that was great. Thank you so much to Rex Smith for moderating. Thank you to Assemblymember Joanne Simon and the other panelists for participating, and especially thank you to AARP New York for sponsoring this important forum. For more information, please check out aarp.org and empirereportnewyork.com. Thank you again.